entered the facility because we were able to test them in their vehicles, which was good. There were a few tested out of our county and reported to us, and I don't know any details about how their testing was done. So that's all good. Our hospital resources as far as PPE and testing supplies are really good. Right now, enough to where we can even offer masks to patients that are here if they don't already have their own, because we're asking that people wear a mask when they're in the building. So right now, medical situation, we're in a good place.
Okay.
So, I'm sorry.
Well, I just said anything else, Bonnie? Go ahead, Lori.
I'm having difficulty hearing. I'm going to try to dial in on the phone.
Jack, I don't know that I have anything just randomly to add to that. Unless you have a specific question, I'm happy to address any specific questions you might have.
No, I don't have a specific question.
We did get in 200 more tests from KDHE today, which was just to the health clinic, the health department, and to the hospital. So we will continue to get more and more testing result or testing supplies as needed.
Good. So unless you want to talk a little bit, or you want to wait for Lori, or?
I can while we're waiting. So emergency services are doing pretty good. All of them are following their protocols and plans for this disease outbreak. They are all doing very well on PPE currently. If we have a major outbreak in the county, then we'll be shorthanded. But currently they all have a decent amount of PPE on stock. And then we're continuing to request more PPE from the state, which we got another shipment today from them. Not everything we asked for, but some that helps. Besides that, the health department, Bonnie Tackett with the hospital, myself, were the main ones that have built this plan together. I have talked to numerous businesses, the city of Atchison, the schools, when we were in the process of building the plan that Lori is going to present to you guys tonight.
I thought the plan was really straightforward and easy to understand.
I guess I have a couple questions, and one of them being, what exactly are we being asked of as the Board of County Commissioners?
They're going to present to us, Eric, the Atchison County reopening plan, and then we're going to receive it.
Well, since we're not clearly the Board of Health for the county, that's just the reason I've got questions.
I think they're just updating the county government.
Okay, this is an informational meeting then.
Yes.
Oh, we probably need to unmute. Hold on one second. Bonnie, can you hear us now on your phone?
Yep.
Sorry, not
How
Bonnie.
are
Can you guys hear me?
Oh, I was like, yeah, I can hear you.
Lori, you can hear us?
So I'm dialed in on my phone and I'm looking at you with my cell phone. So
Okay.
I did not hear much. I just wanted to kind of give you guys some information on our reopening plan. We've been working on it for quite a while. We had to wait and to see what the governor decided before we could actually finalize our plans. Some of her plan is more restrictive than ours, and some of her plan is a little bit more open. This is gonna be at least 14 days. We are seeing an increase in cases, not like some counties, but we also have a lot of testing out and a lot more testing to do. Our numbers went up. I'm monitoring 83 people now. So I just don't want to move too soon, but our plan is pretty close to what the governor has done. Our last case, the 10th case, we were unable to identify the source. So that is probable community spread. And remember, some people are infected and we just don't know it. They don't show any signs or symptoms, but they are shedding the virus and passing that on. Also, local businesses, they can be more restricted if they want to be. I mean, that's just up to the local business. For the salons, personal services actually is one of the things that I had to change because the governor was more strict than I. Also, outdoor activities, recreation, gyms and fitness centers. She was more restrictive on that. So that's where we're at. So we're going to see what happens in the next 14 days and then decide if we go on to the next phase of the plan. And I do believe that all 4 phases are going to be released to the public, but just keep in mind that it could change at any time depending on what's happening with our numbers.
Laura, do you think you should kind of give us an update on what's happening in at least phase 1 at this point? I mean, I've read it, but I think there's people here for public consumption.
Okay, so there's prerequisites that we have to get through before we can go on to the next phase. And the first thing is that we have to be in compliance with governor's order. So for mass gatherings, it's 10. I believe that's what the governor had put on her order. Essential businesses are the same as they were before. Restaurants, I'm a little more strict on them than I was than the governor. We're going to keep it the way it is right now. And we're going to maybe move into her phase next time. Retail businesses, just limit the number of customers in the store at any given time to 5 customers per 1,000 square feet. We need to make sure that they have plenty of sanitation supplies, maintain the social distancing, and enhanced cleaning should be done. Long-term care facilities will probably continue to do what they've been doing. There's still not going to be any visitors allowed at this point. The elderly are one of the, I guess, most affected by this virus. Childcare is going to be the same as it has been. For swimming pools, that's not allowed. That was the governor as well. Community events, entertainment, that was the governor. Education is going to be per the Kansas Department of Health and Environment. And then dental and optical are being allowed with the provider and the patient wearing masks by appointment only with enhanced cleaning.
How does a patient wear a mask with a dentist?
That's what I was going to
Well,
ask.
a dental patient is not going to be wearing a mask. But the provider will, as well as eye protection. And they're also expected to screen all of their patients as they come in for COVID symptoms and kind of keep that at the door. If they're coughing or anything like that, of course, they wouldn't have them in there. But yeah, dental patients not going to be able to wear a mask. That optical, which is even closer, face-to-face, will be wearing a mask.
I would add that we would encourage dental patients to wear a mask when they are not getting their dental care done. So as they're checking in with their front desk providers and until they're starting their dental work.
Makes a lot of sense.
So currently we have 10 positive cases. We've had 0 deaths and 0 hospitalizations. So I know a lot of people are wondering about how many people have recovered. And it's really hard to give that number because some people are recovered but still have some lingering cough and whatnot. Just know that if they're not hospitalized or obviously there's no deaths on our numbers, that they are recovering or are recovered. Negative test results for our county, we're at 153. And then again, we're monitoring 83 people right now.
So Lori, is it possible, and this may be a big request, but we have a meeting every Tuesday at 1 o'clock, an open meeting. Would it be possible for you to appear at the beginning of the meeting and just give us an update for the week? I think people would like to hear that update.
Yeah, I mean, I could definitely try that.
I think Wes could do
I'm
that,
sorry?
Commissioner Barr. I was just going to comment to Commissioner Barr. I think Wes could probably give us an update. Couldn't you, Wes?
I could do so, or we could both show up on there depending on who is the busiest that day, because there are days where she is swapping office of one. So on days where she's free, it'd be great if she could attend the meeting. On days where she's not, I can absolutely cover for her.
Well,
If there was a time, I'm sorry, if there was a time when we both were swamped, you couldn't be there, if you would email an update that it could be read even. I mean, as long as it was current information, it could be presented by someone else or the chairman.
We could do that also.
Okay, so
Yep.
Lori, if you would do that, that'd be great. Wes, if you could appear with her or as an alternate. I think the face of the county health nurse is a real positive thing in the community, and she'll get an opportunity to kind of get out there and talk about what's going on. Because I don't think people can forget that we're in a very big crisis here. I have only been out 3 times in the last 6 weeks, but I was out yesterday and today a little bit, going different places, driving around. I was amazed at the number of people out on the streets, walking in the businesses, close together. So I think people need a reminder. And I think that reminder on a Tuesday might be a good thing for all of us. And any kind of press releases that you might want to do. Lori, do you have anything else you want to cover?
So Wes and I release our daily statistics every day. I think he puts that on Facebook. And what else do you do, Wes, with that?
I post it on social media, our county website. I send it to our local media, and I email it out to an email group, which is around 678 people on that email group.
Okay.
And Commission,
I also want to say I don't have a crystal ball, but I feel like our numbers are going to go up before they come down. I don't think that we've seen everything that we're gonna see here, for sure.
Well, you said you had your first unknown origin case, so that could create community spread. People need to be aware of it.
May I ask,
Exactly, our
what-
last,
I'm sorry, go ahead.
no, it's fine.
What is the magic number that would, the medical community would be happy with, that would be a full opening?
Oh. Bonnie, it's gonna matter,
If you want me to take that one. So
go ahead.
there is no magic number that we would ever be okay with going from where we are now to a full opening. And really that's not so much of a magic number. It's a matter of where are the cases coming from? Is it a known outbreak that's contained where you can say, okay, I know these people work at this place and there's an outbreak at that place and maybe they're essential workers and we know that's where it's coming from and we're comfortable if that's where it's not being spread around the community. If that's what's happening and our numbers are going up, you can still feel fairly comfortable moving to your next phase because you have an explanation. It's when those aren't explained and you're seeing more progression of that. So maybe instead of one likely community spread, like our most recent case, you have 2, maybe 3 of likely community spread. Well, man, that gets a lot more suspicious. We know that some employers are starting to test all of their employees. So we expect for employees that are at those places of work, we're expecting to see a few positives out of those places of work. And if that's all from that place of work, once we identify them, we quarantine and isolate them as appropriate. Some of them may be asymptomatic. And that's what's hard is that's why it's spreading, right? So since they've been identified, then you put them in quarantine and you contain as best you can. There's no way to say when did they get it if they don't have a consistent and their workplace tested them because that's what their work is doing. We talked a little bit in developing this yesterday, like, is there a number where we're no longer comfortable? And unfortunately, it's just more complicated than that. I can tell you if we got a lot of sick people where we don't have the capacity to keep them here at the hospital for people who are needing hospitalized, yeah, it doesn't matter if that's 1 person or 15 people. If the hospital's full and we can't transfer people out, then that's not okay.
Okay, when I said full opening, I want to say, I know it's not going to be a full opening like it had been. It's going to be a full opening with new safety procedures, new precautions, and all of that. So I'm not blindly saying go back to where we were. I'm just saying businesses open with the new norm as far as safety precautions. So I didn't want that to be misconstrued.
Yeah, no, I didn't think that's probably what you meant, but just wanted to make sure I covered bases.
Well, today I saw that Triumph Food in St. Joseph has a major outbreak. Is it a couple hundred, Wes, or more? And a lot of people in Atchison work at Triumph Foods.
They have quite a few employees, and there are quite a few employees that are residents here in Atchison County, and we're awaiting their test results to come back to whether they're negative or positive.
So we're still with a lot of unknowns, aren't we?
Mm-hmm.
And I think
I'd tell you-
there's gonna be a lot of unknowns for a long time. I just feel like we're still learning about this every day, something new. Just today, if you're positive, you have to isolate for 10 days no matter what. Before it was 7. They're just finding out more and more information about this disease every day, and every day there are changes. And I feel like as long as we have so many tests out and we're just unsure of who has it, we need to be really careful. Because my number one priority is just making sure that the citizens are safe.
Pat,
I tell you what,
Go ahead.
I tell you what I witnessed today. We had a movie to take back to Redbox. The CVS parking lot, you couldn't have put another car in it. Then we go out to Walmart to get our groceries picked up. There used to be a person out there standing, counting people to go in. While we were waiting on the groceries, I bet I seen 75 people go in the door. I think the problem that we're going to have is the businesses started out with good policies, and now they're back open 100%.
I think with Walmart, and I understand what you're saying, I think that they can have so many people per square foot. I think Walmart made their own policy, and for so many days, they weren't meeting that capacity. So I think they may have pulled that back. If they were to see an increase in people again, like a huge increase where they would be over capacity, then I can see them bringing those people back out and counting who's going in.
I was there this afternoon and there were people outside counting. There was one at each door. So I saw that this afternoon.
People
Good.
got to remember
This
that.
morning there wasn't.
People got to remember that store is 235,000 square feet. So if you had five people per 1,000 square feet, there could be almost 1,000 people in there under the health guidelines. I don't know what Walmart told them to, but it's a big store. The trouble is they're all concentrated in the grocery side. That's the biggest challenge. I haven't been at Walmart since November, so I can't tell you what it looks like.
I want to say something real quick. I've got a cow that's is down, and I've got a veterinary coming. So if I get up and leave, no disrespect, I have to go when the veterinary gets here. So sorry about that.
Thank
Have
you
him
for
test
listening.
you while he's out there.
What was that, Bill?
Have him test you while the vet's up there.
Maybe, I hope it's not Corvid, but she's down and can't get up.
I do want to say that this panel did think about all of our businesses in our community. And yes, we want to open up everything as fast as safely possible. We understand the stress that all of our businesses and we are going through right now, and this would be a horrible time to deal with this. But the plan that we all came up with together was what we felt was the safest and most cautious plan. And hopefully we can move forward without our numbers going up. But we need to start out cautious and slow to make sure we don't go backwards.
Okay. Pat Henderson, do you have anything you want to say? You were part of this plan. You're on mute, Pat.
I understand. I'm sorry. No, I don't have anything to add. I appreciate the work that Lori and Wes and Dr. Tackett have done on this.
Agreed.
Thank you.
Eric, do you have anything else to add?
No.
Anything else? Bill, you got anything else to add?
I think that that's all for me, unless anyone has any questions.
Bill, do you have anything to add?
Where will people be able
No.
Okay.
Where will people be able to get a copy of the order?
So this will be posted on the county website, social media, local media, and then I send it out to a huge distribution list. This is not everybody in the county, but it is a very large list.
I would just like to end before we adjourn, the comment of, and I've talked to Wes a lot for this process. I haven't talked to Lori or Bonnie. This has been a stressful time, and you've given up a lot of time with your families and everything else. You know, I think sometimes you're just those unsung heroes that really make a difference. I just got a message from Brian Hagan. He's going to post its entirety on MSC News today. So that's good. So the word's going to be out. There's probably going to be questions. It's not perfect for everybody. They're going to be able to see phase 2 and 3 in this release. So they'll see that there's a light at the end of the tunnel.
Correct.
Yeah, I mean, I think we all wanted everybody to see just kind of what it's gonna look like in the different phases. Doesn't mean that's like black and white, but you have to prepare, for anything. And there's people who are trying to prepare for things this summer, and I just thought that would help them maybe make a decision. It doesn't mean that we're gonna be at that stage or that we're not. Hopefully it goes very smoothly and we're there.
I have a question for whoever wants to comment. Governor Kelly's taking a lot of pressure about getting the state open. What if she opens it up and we have a lot of positive cases, whether it be coming out of Triad, food workers, or whatever? How are we going to handle that?
So,
Well, I think that's why you can't really go with a cookie cutter order. You have to look at your county. We have St. Joe on one side, we have with Triumph Food, we have Lansing Correctional Facility, we have so many people who work in so many different areas, and we've had 10 cases, and I know that's not a lot, but we're not a county with 0, or we're not a county with 1 case, or we're not a county with 1 restaurant. We're a bigger county with lots of people going in lots of directions, and so I think that
so we can also lower than the governor, by the way. So the governor started on phase 1, we have to start on phase 1 at the same time. If the governor switches to phase 2, but we have a huge increase in cases, we don't have to switch to phase 2 at the same time the governor does. We can lag behind a week or 2. We cannot go faster than the governor though. So say the governor gets to phase 2 and she stops and she sits there for a while, we can't go to phase 3 until the governor goes to phase 3.
I was also going to point out that in her address last night, she specifically said one of her goals was to return that decision-making process to the local officials. So legally, that's Lori. We have been doing things as a team, but that's what the governor's intent was, is to say, hey, there are some areas where this is not safe and they should not be opening yet, regardless of what we're saying as a state. But there are some places where it may be okay, especially when you look out in some places in Western Kansas where they have not had any cases. It makes a little bit more sense for them to open there. Whereas some of the counties in the major metropolitan areas, maybe it's less safe. And you have to rely on each county's officials to make that decision. And we weighed that pretty heavily, especially with a new case coming in this week. We took that very seriously in our considerations when we discussed it as a team on, are we safe to open now or should we wait?
Well, thanks for the information. Thanks for the outline and the guide. I guess we got to call it a guide at this point because it's all
it's a work in progress.
Change. So this is our guide now. And, hopefully, I think most of our citizens will adhere to it. Most of our businesses will do that. And I have a feeling that people see abuses, they tend to maybe take care of it themselves by just addressing whoever it may be. They always said that how do you enforce no smoking in an area? Well, chances are the other people in the area will enforce it. It doesn't take the police or anything else. So citizens will police this pretty well.
Yep.
I would entertain a motion to adjourn, unless there's anything else. So I take a motion to adjourn at 4:34. You're going to have to make the motion. And I'll second it. All in favor, signify by saying aye. Aye. We're now adjourned.
Thank you.
Thank you, everybody.
Thank you.